Let's talk newborn sleep. Newborns, or babies from birth up to 3 months of age, need about 14 to 17 hours of sleep in a 24-hour period. During this time, their sleep patterns are highly unpredictable. So, what are some characteristics of newborn sleep? While their sleep patterns are unpredictable, during the first month of life, babies can stay awake for about 35 minutes to an hour before they need to go back to sleep. During months 2 and 3, this wake interval increases to an hour and a half. They wake up every few hours to feed. Breastfed babies feed every 2 to 3 hours, while formula-fed babies generally feed every 3 to 4 hours. Second, newborns are restless sleepers. This is because they spend almost 50% of their sleep in the REM, or random eye movement stage of their sleep cycle. This is why they often move, kick, or stretch during sleep. Third, newborns are noisy sleepers. Newborns have an immature breathing control center. This is why they often grunt or make weird noises in their sleep. This can be alarming to new parents, but in most cases, it's just a part of normal newborn sleep. And fourth, newborns don't have a sense of day and night. When in the womb, newborns are used to being in a dark environment and sleep for longer during the daytime when the mother's daytime movements lulls them to sleep. It's only at 3 to 4 months that they begin developing a circadian rhythm or a sense of day and night and begin to sleep for longer stretches during the night. So, what are some things that can help with newborn sleep? The first is establishing a bedtime routine. Having a calm and consistent bedtime routine from the beginning can be helpful. This routine can consist of feeding, rocking, or shushing. 2. Keep an eye for your baby's sleep cues. These can include yawning or rubbing their eyes. 3. Create a conducive sleep environment. In order to help babies develop their circadian rhythm, it's a good idea to make sure they get plenty of light exposure during the daytime when they're awake, and similarly in the night and evenings, the room that they sleep in is dark and cool. 4. Giving newborns a few minutes of tummy time during the day can help develop their shoulder and neck muscles. And lastly, practice safe sleep guidelines to minimize the risk of SIDS.